Good morning, afternoon, wherever you are, and have a look at this. So a frozen image is the best kind of image in endoscopy. Well, not always, but certainly to assess a lesion, to assess something wrong. And if we just assess this image for a short period of time, you will see that the contour is all a bit wrong. It's not particularly regular, and there's kind of a dimple or a depression in the middle of this picture. So let's get back to normal light. Let's go to white light, and let's start again. So we are here using GIF EZ1500 endoscope. Many advantages of this imaging platform. It's for sure one of my favorites. And why is that? Because from afar you can see just as well detail as you can up close. So we're going to try and demonstrate that to you here, and we're going to try and take you through. I'm here with PTN. My colleague here uses the camera. I'm going to try and take you through just how you assess a Barrett's esophagus, right? So we got our Geek Symposium coming up. One of the big focuses is Barrett's esophagus, because Barrett's esophagus is one of those conditions where you can miss cancer quite easily if you do a inadequate examination, and maybe that examination is inadequate for many reasons, including potentially that the patient is inadequately sedated. Anyway, we're going to just come back here. Use of a cap is very important because you can push things away to have a look. And so people say you should spend a minute per centimeter of Barrett's. Immediately something jumps out in white light, and it is this kind of raised area. But actually that's about the only thing that jumps out in white light, right? And then when you go up closer to it, when we can get a little bit closer, you can already appreciate that there is something wrong with this area in front. Okay, we store that in our mind. We'll need acetic acid shortly to have a look. But here we have, using the cap, because this is a big angle to have a look around, and so we just use the cap to also look in there. Actually, we know that the worst place in Barrett's is at the 4 or 5 o'clock, but this is not normal anatomy by the look of this, or at least it's a large hiatus hernia, so we need to carefully examine all areas. So I think we've done that in high definition white light, and we can really see the advantage of this imaging platform if we look here, where the detail is really visible both in the distance and up close. We'll come back to more advantages in a second. And then with narrowband imaging, we can focus on that area, and it becomes more and more clear, as we started off with, that there's something there. Something, is it a big thing? Is it just that nodule? Is it a bigger area? We'll come back to that when we start to look closer. And we should spend a lot of time looking in virtual chrome endoscopy, same amount of time, and what we are looking for essentially is irregularity amongst the regular. And we don't see it. Maybe it's a little bit inflamed here, or we can nicely use the cap. But of course you can short circuit all of this. If you are having not so much experience of narrowband imaging, you can short circuit a lot of this by using acetic acid in Barrett's esophagus. So acetic acid, what does that bring to the table? It brings to the table really beautiful clarification of the pit pan. And that can help you with the distinction between regular and irregular, but it can also help you because the areas of Barrett's esophagus which are not normal tend to lose the white color more quickly. So we're going to gently put it down the channel, and then we're going to suction the lumen a bit closed without trying to suction onto the lesion to really coat the whole Barrett's esophagus. Gently, right, because you don't want the patient to aspirate on it. This patient's intubated, but really we want to get great coverage. And then you've got about 20 seconds. You can see the esophagus contracting in response to the acetic acid, not something you really want in your esophagus if you're awake, probably. And let's have a look. So you can see already that we have, just from afar, with this imaging platform, such beautiful contrast. In the distance, often it can be more blurry, but here in the distance, and as we go closer, you can still see really beautifully, without having touched anything, the contrast here. You can see that these glands here in this image are crowding together, way more than the glands, for example, if we look in a standard piece of Barrett's esophagus. These are all kind of nicely spaced, normal spaces between, but here, that is not the case. Here, we see crowding of the glands. So they're coming together more, they're growing more irregularly. Also, it's the case here. And here, I think we see something relatively abnormal where actually that glandular pattern is almost totally lost in the center over there. And here also, in this area, we see a little bit of what you might call ulceration or surface fibrin. I would call it more surface fibrin because almost certainly we can wash it off. But just look at this. I'm not even using near focus, and look at the definition you have on the Barrett's esophagus. And then you can game change it by putting the magnification a bit more on. Look at that. Really beautiful image of that area. And we'll come back to it in just a second when we use water. Let's also look at this. So again, look at the microstructure of this area where we can clearly see probably high-grade dysplasia, like real gland crowding. And then this area which we were worried about before over here, where again I suspect that this is another early cancer in Barrett's esophagus. So multiple areas of this part of the esophagus show changes consistent with early cancer. And for you, PTN, when you're looking at these, what is the biggest giveaway? I mean, someone's not an expert, right? Because you've done a lot of this, you've got a lot of an idea. But what is the biggest clue for you that there is something really wrong here?
I think one of them, or most of them, you already covered. We see something jumping out in white light already. That should tell you there is something wrong. Then you put on the NBI, and we see some color changes. Not everything is the same color, not everything is the same structure, and we don't have to define which structure it is, but we see irregularity. We see something that is not completely regular. This should also pull our attention. And then in the little bit more distant part, there's also a slight oozing. It's not really bleeding. If we go up closer, we saw it a bit better before. That should always draw your attention also in Barrett's.
Yeah. And here we see also the acetic acid now. So a lot of it's still white, but these areas are red. So this should draw your attention, as you exactly said. You look for the red and you go closer in that area. It's really nice in white light, but it's where the gold comes in with virtual chrome endoscopy. And then, of course, if your patient is intubated and you don't put your water jet too high, because if you do, you will not be able to do anything, maybe a little bit higher than this, so maybe we can just turn it up a little bit. If you add some water to the situation and you use a cap, then you really can get probably the most beautiful images. And that's one of the huge standout features of this imaging platform as well, is that underwater you can see just as you can outside water. So you see here, not even on near focus, look at the image, incredible, pause it, we can already tell that's a cancer. There's no structure at all, no pit pattern at all in a center. So probably it's an early Barrett's cancer, superficial potentially. And then when we go, look at this, look at the water. So adding the water magnification effect, you can beautifully characterize that. You can clearly see the surface fibrin. It's just kind of peeling off with the water.
Also very nicely see demarcation line where you have your bigger normal pits going to something that is losing everything.
So this is cancer. And why is it cancer and not inflammation? Because there is not complete regularity here. We have the surface fibrin, and around it there is also no inflammation. So that's another critical point, that you don't see inflammation elsewhere, but you see a really focal area which is got a bit of a depression, the pit pattern is lost, it has surface fibrin, and if you look at the vessel pattern here, it is not regular. So that is the critical feature. And then there was one other area we wanted to look at. So this can be a biopsy site, but I would suggest it isn't. Why? Because if we look at it, the structure of it is really not regular at all. And under that fibrin, if we could wash it off, which is not washing off very easily, probably would see a completely disordered vessel pattern. So yeah, that's how to image Barrett's esophagus. And of course you need to spend time, and look how easy it is underwater if you have the option to look with this imaging platform. Once you've added the chromoendoscopy, right? And that here is acetic acid, to get these beautiful, beautiful images. And when you see this, I mean, you know there is nothing wrong. Maybe it's a little inflamed because it's a little bit more dilated, the pattern, but there is nothing wrong here. And of course, it's very important, if you're using water, you can also use water to flatten out the bends so you can nicely see around the corners. And it's actually very difficult here to see this area, but we didn't really coat it so well with acetic acid, but so that you're using the cap to really expose these parts. So of course what you're seeing here is best practice. You're seeing great imaging platform, you're seeing a lot of expertise, you're seeing a lot of experience, but it is possible to replicate this in a normal situation if you just follow the principles. That image when I started, when you pause this image here from afar, it's not the right shape. You had acetic acid, it's too red. You zone in on those areas, you take some nice photos, like even if you just take that photo, and then you put on your virtual chrome endoscopy, you go up to the thing and you just take something like this. I mean, someone who's an expert is going to look at that and say that is a cancer, and this also. So yeah, I hope that's useful. I think it's a nice overview of the way to do this, and it's a beautiful demonstration, in my opinion, of this imaging platform to look at the esophagus combined with both virtual and standard chroma endoscopy. So thanks so much for watching, and we look forward hopefully to seeing you soon, end of September, at our GIEQs event here in Ghent, in person or online. See you soon. Bye-bye.